Assalamualaikum warahmatullahi wabarakatuh, and a very good day, everyone. Thank you for tuning in to our Shena webinar in conjunction with the World Day for Safety and Health at Work 2026. My name is Wdshw from the Investigation and Response Division of Shena, and I will be introducing you to the workplace safety and health notices together with an overview of the workplace incidents, statistics, and trends observed in 2025.
My name is Nabila Haji Abdul Rahim from the Compliance and International Division of Shena. I will cover Shena's key legislations that are relevant to the incidents as published in the 2025 WSHNs.
Workplace Safety and Health Notices, or WSHNs, are short publications issued by Shena to highlight critical lessons from workplace incidents to prevent recurrence. These notices serve as an important reminder to workplace of their legal obligation and the requirement to comply with relevant legislation. The issuance of these notices are triggered by fatalities, incidents caused by persistent gaps in the management of the safety and health matters, or initial incident notification (IIN) received by Shena. There were 6 WSH notices that was issued in 2025. In 2025, Shena received a total of 318 initial incident notifications, or IIN for short. The majority of injuries involve superficial injuries and open wounds, with upper extremities such as hand and arms being the most commonly injured body parts. These statistics reflect that many workplace incidents continue to involve routine tasks and everyday work activities. Next, we look at the work-related fatalities. Today, Shena have recorded 86 work-related fatalities. When we review work-related fatalities recorded since 2013, one trend remains consistently visible: fall from height. It continues to occur almost every year. These include fall from ladder, roof, scaffolding, and other elevated work activity. In 2025 alone, 5 out of 6 fatalities involve fall from height. This clearly shows that work at height activities remain one of the highest risk workplaces hazard. Another observation is that the construction industry continues to record the highest number of fatalities. There are 6 WSH notices issued by Shena in 2025. An important observation is that 2 separate WSH notices were issued specifically on ladder safety. This reflects the seriousness of and recurring nature of 4 related incidents. The first WSHN notice issued in 2025 is the importance of compliance to the workplace safety in towing operation. This notice highlighted safety concerns during towing and roadside recovery operations, including workers failing to adhere to PPE requirements, unsafe positioning of tow trucks, inadequate traffic control measure. In one fatal accident, a tow truck driver was struck by an oncoming vehicle while setting up towing operation. By proactively addressing this risk, towing professionals can ensure safer and more efficient operations while maintaining compliance to the Workplace Safety and Health Act. Work at height, or WAH for short, continue to be one of the leading causes of serious workplace injuries and fatalities. In 2025, there were 23 injuries related to ladder use and 5 fatalities involving fall from height. The type of injuries resulting from the fall ranges from fractures, sprain, concussion, internal injuries, and also fatalities. Construction industry is one of the most affected sectors. To address these recurring issues, Shena issued 2 WSHN related to ladder safety. Key preventive measures shared in the WSHN including using the appropriate type of ladder, ensuring proper ladder setup, adapting two-person rules, strengthening training and awareness, implement the safe work practice, and by making incident reporting when an incident occurs and the follow-up. Next is about managing risks from harmful insects and animal attacks in the workplace. In 2025, Shena recorded a total of 13 workplace injuries caused by dogs, snakes, and horses. One incident from the animal attack resulted in finger amputation. Although this incident may not always receive significant attention, they can still result in serious injuries and long-term consequences. This highlights the importance of ensuring risk assessment also consider the environmental where it's relevant. Now we look at the workplace injury related to the use of cutting machinery. In 2025, Shena recorded 80 incidents involving cutting machinery ranging from deep laceration, amputation, eye injuries, and eye infection. These incidents occur across multiple industries including construction, manufacturing, and food processing. Machinery involved including grinders, circular saws, chainsaws, cutting torches, and meat cutting machine. Common issues identified during investigation include missing machine guards, improper use of equipment, inadequate training, unsafe work practice, and poor maintenance. Machinery-related incidents often occur within seconds. A single lapse in concentration, rushing a task, bypassing safeguards, or improper handling can result in a permanent injury. Employers must therefore ensure effective machine guarding, regular inspection, competency training, safe work procedure, and proper supervision are consistently implemented. Lastly, we look at the notice on safety precautions for safe loading and unloading vehicles. Shena recorded 10 injuries related to loading and unloading vehicles in 2025. The injuries included fractures, cuts, crush injuries, and amputations. These activities often involve multiple hazards occurring simultaneously, including moving vehicles, unstable loads, poor communication, and unsafe worker position. Investigation identified contributing factors such as improper load securing, workers standing within the line of fire, and inadequate coordination between driver, operator, and worker. Supervisors also play a critical role in ensuring loading and unloading operations are coordinated safely. Across the incidents and WSH notices issued in 2025, several recurring issues were constantly identified. These include lack of training, human factors, supervision gaps, failure to learn from previous incidents, and unsafe system of work. These issues are repeatedly observed across different industries and different types of incidents. A strong safety culture requires organizations to continuously identify gaps, encourage reporting, investigate incidents properly, and most importantly, act on the lesson learned. Failure to learn from previous incidents often result in the same incident recurring. The incident and recurring issues discussed so far are closely linked to the workplace safety and health legal duty. I will now pass the floor to my colleague Nabila from Compliance and International Division, who will be sharing more on the Workplace Safety and Health Act and its relevant legislation.
Thank you, Lydia, for sharing the statistics and providing an overview of the notices. The remaining webinar will focus on key sections of the Workplace Safety and Health Act, Chapter 277, and legislations relevant to the incidents. Shena enforces two acts, and one of them is the Workplace Safety and Health Act, Chapter 277. The WSHA relates to the safety, health, and welfare of persons at all workplaces. It places duties on the employer, occupier, principal, and persons at work. The Act also ensures risks are reduced to as low as reasonably practicable. There are three main objectives of the Act. First is to prevent accidents and occupational diseases by minimizing risks through risk assessments. Second is to establish joint responsibility with stakeholders, ensuring we take proactive steps to reduce risks. Third is to improve safety and health culture by increasing awareness through training and compliance, and again by having a proactive approach. In essence, the objectives are geared towards prevention of incidents. One of the objectives of the Act earlier touched on compliance. But why does compliance matter? Firstly, it is part of the legal duty to comply. This enforces the prevention approach in ensuring safe and healthy workplaces. The second and third reasons are linked to our duty of care, making sure ourselves and the people around us are safe and healthy, so at the end of the day, we return home safely. The fourth reason is protecting reputation. By having a good track record, it boosts credibility and trustworthiness within the organization and with external stakeholders. And lastly, by ensuring compliance and safety and health of workers, this leads to operational continuity and efficiency, therefore improved productivity. There are a number of regulations under the Act. For this webinar, I will touch on the general duties under the Act, parts of the Work at Height Regulations 2025, key concepts of risk management, and a small part of the safety and health management system as stipulated under the General Provision Regulations. Section 11 of the Act is the general duty of the occupier. An occupier is a person who has charge, management, or control of the premise. The occupier has a duty to ensure the workplace, access and egress, and any machinery, equipment, plant, article, or substance kept are safe and without risks to health to people within the premise. Section 12 is the general duty of employer. An employer is a person who employs any person to perform work under a contract of service. The employer has a duty to ensure safety and health of workers by ensuring a safe work environment, by ensuring persons are not exposed to hazards, by implementing emergency procedures, by providing instruction, information, training, and supervision, and by providing adequate safety measures for machinery, equipment, plant, article, or process. I would like to emphasize the importance of training. 4 out of the 6 notices identified the lack of training of workers. Workers shall be properly trained and certified. This provides assurance that the workers are competent to execute their tasks in a safe manner. Sections 14 and 14A are the general duty of principal. A principal is a person who engages a different person under a contract of service to do work. A principal generally has the same duties as an employer, and additionally, the principal is also responsible to ensure that the contractor engaged has the expertise for the job, implemented safety and health measures at work, has sufficient experience and training to execute the tasks, has the necessary documents prior to start of work, has conducted a risk assessment, and has communicated safe work procedures to any persons that may be affected by the risks involved in the work. I would also like to highlight here that the duty of principal also includes training or trained and competent contractors. Section 15 is the general duty of persons at work. The duties include using personal protective equipment as required, cooperate with the employer or principal, not willfully or recklessly endanger themselves and others, and not willfully or recklessly commit any act that endangers themselves and others. PPE is highlighted here as 4 out of the 6 notices included PPE as one of the key control measures. Additionally, one notice identified the worker not using PPE as a preliminary finding to the fatal incident. It is important to note that employers are responsible for providing PPE to their employees. The next couple of slides will be on the Work at Height Regulations 2025. 2 of the notices were on incidents related to the use of ladders, and one of them resulted in a fatality, so it is essential to socialize this regulation. The Work at Height regulation contains provisions to ensure work at height activities are carefully planned, regulated, and safely implemented by competent persons using correct and suitable equipment. The regulation is applicable to all workplaces that involve work at height. This means work where there is a risk of falling, of which people can be injured from it. An exception is for Part 3 of the regulation, which only apply to hazardous work at height, which means work above 3 meters. When it comes to work at height, the first option is to avoid work at height if it is reasonably practicable to do so. If work at height is required, a fall prevention plan shall be established and implemented for hazardous work at height. FPP is a documented site-specific plan prepared for the purpose of eliminating or reducing risk of falls. Workers executing work at height activities must be trained and must be supervised by competent supervisors. This links back to the general duties of employer and principal. The preliminary findings from the fatal ladder incident included absence of FPP, worker was not trained, and lack of supervision throughout the work activity. This tragic incident reflects a failure in safety planning and a breach of the duty of care by the principal and employer of the worker. When working using a ladder, one of the common risk factors that lead to an incident is the use of damaged or makeshift ladders. According to Regulation 18, ladders shall be of good construction, sound material, and adequate strength, free from pattern defects, and suitable and safe to use. With the exception of fixed ladders, the surface of ladders shall be stable, level, and firm and of sufficient strength to support ladder and any person and load intended to be placed on the ladder. The fatal ladder incident occurred when the worker fell from height of approximately 4.76 meters. This constitutes as hazardous work at height activity and therefore would have required a permit to work prior to start of work, as stipulated in Regulation 19. Shena has resources on work at height to guide workplaces to work safely at height. These resources are readily available in the Shena website. The next key regulation is the Risk Management Regulations. 4 out of the 6 notices included risk assessment as one of the key control measures. The fatal ladder incident identified that there was no risk assessment conducted as one of the preliminary findings. It is a requirement for all workplaces to conduct a risk assessment and to record or document it. Risk assessment shall be communicated to any person who may be exposed to the risks. When determining control measures, it is important to refer to the hierarchy of control. The most effective control is elimination of risks. For example, referring to Regulation 4 of the Work at Height Regulations, it is the avoidance of work at height where it is reasonable to do so. In most cases, more than one control measure is implemented to effectively reduce risks to as low as reasonably practicable. In line with this year's theme of World Day for Safety and Health at Work, this is a reminder that mental health is equally important as physical health. Therefore, psychosocial hazards should be included in risk assessment where necessary. The notice on towing operations highlighted stress and fatigue from long working hours as one of the key risks, and therefore one of the control measures would be to provide mental health support or stress management training to enhance worker well-being. For detailed guidance on risk management, please refer to the Code of Practice, which provides practical guidance to comply with the risk management regulations. The requirement of having safe work practice and procedures is part of the Safety and Health Management System, which is stipulated under the General Provision Regulations. 3 of the notices indicated having safe work practices and procedures as one of the necessary control measures. Safe work practices provide an outline of general statements or general rules on what shall or shall not be done to perform the job safely. On the other hand, safe work procedures provide detailed step-by-step guide that ensures tasks are done safely from start to finish. Having clear practices and procedures and ensuring these are communicated to workers help to reduce incidents and keep everyone protected at the workplace. This webinar has summarized workplace safety and health notices published in 2025, highlighting key information of the 6 incidents. In essence, everyone at the workplace has responsibility to ensure a safe and healthy workplace. From a management level, it is important to lead by example and enforce accountability on safety and health matters on everyone at the workplace. Resources shall be adequately allocated for training, which ensures workers are competent to carry out their work. Learning from incidents by reviewing Shena's notices provide awareness of common workplace incidents that can be avoided. Supervisors have a crucial role in actively monitoring work sites, including ensuring implementation of risk assessments. Competent supervisors are able to promptly identify unsafe acts and conditions and are able to stop work when these situations arise. Employees shall follow safe work practices and procedures of their dedicated tasks. Employees are advised to voice out their concerns should there be any unsafe act or condition. Open conversations with supervisors should be held to address these situations.
Every statistic represents a real person, a real injury, and a real impact on workers and their families.
Every incident carries a lesson, and through proactive leadership, effective risk management, and continuous safety awareness, we can work together to create safer and healthier workplaces for everyone. We hope today's session has provided valuable insights into the importance of learning from workplace incidents. Thank you.